Some practice questions in relation to anatomy and diagnostic content within the endocrine system. As with all of our practice question videos, I do ask that you pause the video after we initially review the question and the answer options. That way you can come to the correct answer independently, and then you can resume the video and we will review the rationale together. All right, so our first question is a classic multiple choice style question, testing your knowledge of physiological integrity. The nurse is caring for a patient who presented to an outpatient endocrinology office with complaints of increased sweating, darkening of the skin, a rounded face, and an abnormal fat pad located between the shoulder blades. The physician has ordered the completion of an overnight dexamethasone suppression test. When providing education to the patient on the testing, the nurse would include which of the following. So we have a patient that is going to be completing a dexamethasone suppression test. So what teaching are you going to provide to the patient in regards to that testing? All right, so the correct answer option is that the test is used to diagnose Cushing's syndrome and to evaluate pituitary function. So an overnight dexamethasone suppression test is a test used to diagnose Cushing's, a condition in which there's an excessive amount of cortisol in the body. So during the test, the patient takes a dose of dexamethasone, which is a synthetic glucocorticoid at bedtime. The next morning, the blood cortisol levels are measured. In a person with normal pituitary and adrenal function, the dexamethasone should suppress cortisol production. However, in a patient with Cushing's syndrome, cortisol production is not suppressed. So the test can also help to evaluate pituitary function, as the pituitary gland is responsible for regulating cortisol production. So the overnight dexamethasone suppression test is used to distinguish between Cushing's syndrome and Cushing's disease. All right, here is a matrix multiple choice style question. The nurse is providing education to a patient prescribed a radioactive iodine uptake thyroid function test. So, just like with all of our matrix multiple choice, you are going to look at these patient statements and determine if they are true, accurate, and demonstrate an understanding of the teaching, or is the statement false, inaccurate, and demonstrates no understanding of the teaching. All right, so our two accurate statements that demonstrate an understanding of the teaching provided is that a small dose of radioactive iodine is given orally. And if I have 45% of measured radioactivity in 24 hours, I have hyperthyroidism. So radioactive iodine can be given PO or IV. It is measured initially at 2 to 4 hours and then again at 24 hours for a second time. Your normal results is 3 to 10% at 2 to 4 hours and then 5 to 30% in 24 hours. So if those readings are elevated, that is indicative of hyperthyroidism. Whereas if those readings are decreased, that is indicative of hypothyroidism. All right, this is a classic multiple choice, testing your knowledge of physiological integrity. A patient presents to her outpatient primary care physician office with complaints of irritability, hair thinning, anxiety, menstrual abnormalities, and intermittent palpitations. The nurse reviews the patient's recent lab results, significant for a TSH level of 0.2. The nurse concludes that the patient is likely presenting with which of the following. So she's having irritability, hair thinning, anxiety, her cycle is abnormal, and her TSH level is 0.2. Is this patient presenting with primary hypothyroidism, hyperpituitarism, hyperthyroidism, hypopituitarism, or Cushing's syndrome? So this patient is presenting with hyperthyroidism. So a thyroid stimulating hormone, or TSH, is specific in the diagnosis of either hyperthyroidism or hypothyroidism. So a normal TSH is 0.5 to 5. An elevated level is indicative of primary hypothyroidism, and a decreased level is indicative of hyperthyroidism. So you know the level is 0.2, which indicates hyperthyroidism. And then when you're trying to think of the assessment findings and the differences between hyper and hypothyroidism, just think with hyperthyroidism, think hyper. Everything is sped up and moving quickly. So you're very irritable, you're anxious, your hair is thinning, you're going to have maybe diarrhea, loss of appetite, heart palpitations. Whereas with hypothyroidism, everything slows down. You're going to feel very fatigued, very sluggish. You might have some constipation, some weight gain. So that's an easy way to kind of differentiate the assessment findings between the two. All right, this is a multiple response select all that apply, testing your knowledge of physiological integrity. The nurse is providing education to a nursing student on the anatomy and functions of the endocrine glands. Which of the following statements are true regarding the adrenal glands? Select all that apply. So which of these statements are true and accurate? The adrenal glands are located above the kidneys. The adrenal cortex secretes hormones such as cortisol, aldosterone, and androgens. The adrenal medulla secretes hormones such as adrenaline and noradrenaline. Addison's disease is a disorder characterized by excessive production of adrenal hormones. And Cushing's syndrome is a disorder characterized by excessive production of cortisol by the adrenal cortex. So more than one answer can be true, so which of these are true or accurate? All right, so the adrenal glands are located above the kidneys, and they consist of two distinct parts. You have the outer adrenal cortex and the inner adrenal medulla. The adrenal cortex secretes hormones such as cortisol, aldosterone, and androgens, whereas the adrenal medulla secretes hormones such as adrenaline and noradrenaline. Addison's disease is a disorder characterized by the inadequate production of adrenal hormones, not the excessive production of such. And then Cushing's syndrome, on the other hand, is a disorder characterized by the excessive production of cortisol by the adrenal cortex. All right, we have a classic multiple choice testing your knowledge of physiological integrity. The nurse is providing education to a nursing student on the anatomy and functions of the endocrine glands. Which of the following statements are true regarding the hypothalamus? So I want you to think about what you know about the hypothalamus, its function, what it does in the body, and select which of these statements are true regarding the hypothalamus. All right, so the hypothalamus is responsible for controlling the pituitary gland and regulating the secretion of its hormones. So the hypothalamus is a small region of the brain that plays a crucial role in maintaining homeostasis in the body. One of its main functions is to control the pituitary gland, which is often referred to as the master gland of the endocrine system. The hypothalamus produces and secretes hormones that regulate the secretion of hormones from the pituitary gland, which in turn regulates the activity of many other glands throughout the body. So some of the hormones produced by the hypothalamus include corticotropin releasing hormone, which stimulates the release of the adrenocorticotropic hormone from the pituitary gland, and then the gonadotropin releasing hormone, which then stimulates the release of FSH and luteinizing hormone from the pituitary gland. So overall, the hypothalamus is responsible for controlling the pituitary gland and regulating the secretion of its hormones.